Hello, I'm Shivam, and in this video, we're going to take a deeper dive into the Bristle test, what you'll find in the report, how to use those insights, and importantly, how the Bristle test is different than other salivary tests out there. We'll focus on why those differences actually matter in a clinical setting so you can feel confident using this as a tool within your patient care. Now, if you haven't yet watched the testing overview video, I'd recommend checking that one out first. But just to give a quick refresher here, at Bristle, we analyze the full microbiome with just a single saliva sample. So that means we're looking at all 800 plus species of bacteria and fungi that can be found in the mouth. So not just the pathogens, but also the beneficial species that support oral health. If a species is in the mouth, our test will pick it up. So how do we actually do this? We use a technology called shotgun metagenomic sequencing. Unlike qPCR tests, which usually look at just a handful of species, this method allows us to capture everything present in the sample, all the way down to the strain level. It's much more comprehensive and it gives you a clearer view of the whole microbial community. With every report, you'll get a full breakdown of all of the microbes that are detected in your patient's sample, as well as the abundance levels. On average, we find that most people have somewhere between 50 to 150 unique species, and each patient has different species at differing levels. Now, a raw list of all the microbes isn't very actionable on its own, so we distill that information down into 7 key insight scores that are all based on a 0 to 10 scale. These scores give you a quick root cause view into both oral health and systemic health implications for the patient. We also highlight certain key pathogens and show which systemic diseases they're associated with based on research. This can be a great educational tool for your patients to help them connect their oral health to their overall health. For each of the 7 insight scores, like beneficial bacteria, gum inflammation, and tooth decay, we provide a breakdown of all of the species that contribute or roll up into that 0 out of 10 score. So now that we've covered the basics of the report, let's get into what makes Bristle stand out compared to other salivary tests. Here's a very quick snapshot comparing Bristle with some other salivary tests you may have used or heard of. The key difference you'll notice is our analysis method. We use shotgun metagenomics, which I referred to earlier, to look at everything in the microbiome. Bacteria, fungi, all at the strain level, just using a single saliva sample. And despite being more comprehensive, the cost is similar, and in some cases actually even less, than more limited tests that use the older qPCR technology. There are 4 main areas that differentiate the Bristle test. Number 1, complete microbiome analysis, so you get a better sense of balance versus dysbiosis. Number 2, more accurate risk assessments for conditions like caries and periodontal disease. Number 3, additional health and wellness insights beyond oral health, things like gut health, nitric oxide, and halitosis. Number 4, clinical guidance and support to make sure you and your team are successful in implementation. So let's unpack each one. Let's start by talking about balance in the oral microbiome. Here we've got 2 patients, patient A on the left-hand side and patient B on the right-hand side, and we're looking at their levels of periodontal and caries-related pathogens if we had just measured the pathogens. So based on the charts at first glance, both have very similar levels of the periodontal and caries pathogens. Based on this alone, you might assume that they're both high risk for periodontal disease and both relatively low risk for caries. But when we look at their full microbiome and see the beneficial bacteria like we are here, we see a very different story. So on the left-hand side, patient A has very high levels of these green protective beneficial species that are likely keeping those pathogens in check, meaning their actual periodontal disease risks could be very low based on the microbiome. Patient B is also more balanced than what we previously would have assumed, but likely still moderate risk. This complete data and looking at the beneficial bacteria gives you the full picture to truly assess if a patient is in a state of balance or dysbiosis and ensure you're choosing the proper treatment based on risk levels. Beneficial microbes play a huge role in keeping the mouth healthy. They help suppress inflammation, balance pH, remineralize enamel, and prevent pathogens from gaining a foothold. Studies have even shown that repeated use of antibiotics or antimicrobial rinses can actually be very disruptive and cause future dysbiosis. So with Bristle, you can determine how treatments impact not only the pathogens, but also the levels of these beneficial species and help your patients restore the overall balance of their microbiome. Moving on to number 2, Bristle gives a more accurate profile for caries and periodontal disease. Both of these diseases are polymicrobial, which means they're caused by communities of species interacting with each other, rather than just a single pathogen like strep mutans or P. gingivalis. With the Bristle test, you're not limited to just getting a few of the contributing species. You're getting a measurement of all of the species that can be contributing to caries and periodontal disease. And as research evolves and continues to uncover different dynamics between these species or even net new species that play a role in these diseases, we can easily incorporate those insights into our risk scoring because we're already detecting them. This side-by-side gives you a quick snapshot of the caries and periodontal pathogens that we detect at Bristle compared to more traditional tests. You'll see we include dozens more species because these diseases are complex and there are many different contributing microbes. For tooth decay and caries specifically, there are certain pathogenic microbes that produce acids, but there are also beneficial microbes that can combat the impact of these acid-producing species. Again, it's a polymicrobial infection, not just caused by strep mutans or a couple other species. Our score for tooth decay includes over 20 plus decay-related species, plus 20 beneficial species. It helps you determine if symptoms are caused by ongoing microbial activity or if the damage is historical and the microbial risk is actually low. If the latter, it can help point you to look at other potential root causes, like mouth breathing or a very acidic diet. For gum inflammation and periodontal disease, it's a very similar story to tooth decay and caries in that the disease is polymicrobial. Beneficial bacteria can help mitigate the disease from progressing, but there are over a dozen different pathogenic species that can cause inflammation, and it's not just the red and orange complex ones. So for our gum inflammation score, we include over 18 different periodontal pathogens as well as their beneficial counterparts. A high score for gum inflammation, even without symptoms, can signal that future risks exist, and it actually gives you an opportunity to intervene and help prevent the disease from progressing. The third area that sets Bristle apart is our broader health and wellness insights. So in addition to the primary oral health insights, you'll also get scores for halitosis, gut impact, and nitric oxide. So let's take a deeper look at each one of those. So let's start with halitosis, which unfortunately is a condition that a lot of patients silently struggle with. And 90% of the time, it originates from the mouth. With the Bristle test, you can identify the microbes that cause bad breath, including those that produce volatile sulfur compounds or other malodorous compounds like putrescine. In addition to the 0 out of 10 halitosis score, we go a step further and actually categorize the patient's halitosis into predominantly one of 6 different types, and that's based on the microbiome profile, ultimately allowing you to better personalize their care. So let's say if a patient's bad breath is largely driven by anaerobic bacteria living beneath the gum line, things like flossing and cleanings will be far more effective interventions than with a patient who has primarily tongue-coating species, where something like tongue scraping 2 or even 3 times a day is going to be most effective. This level of detail allows your patients to truly understand the root cause of any bad breath symptoms. Even in the instance where they have symptoms, but the halitosis score comes back low, that can actually help rule out the mouth as the primary source and signal looking into a different source, like the gut or the throat. The second wellness insight we provide is for gut health. The oral and gut microbiomes are directly connected. Some species like Klebsiella can travel from the mouth to the gut and trigger inflammation. And there's also immune signaling between the two sites. In fact, patients with IBD or Crohn's are actually twice as likely to have periodontitis. Our gut impact score shows how much a patient's oral microbiome might be contributing to their gut issues. It's not a gut test, but if a patient has GI symptoms, a high score here can flag that the mouth might be a potential contributor. And it helps educate patients on the importance of their oral health and how balancing the oral microbiome can in turn improve their gut health. The third wellness score we provide is for nitric oxide, which is a molecule that is critically important for both heart health and cognitive function. There are certain oral bacteria in our mouths that help convert nitrate from our diets into nitric oxide, but that conversion depends on the presence of specific species of oral bacteria. If those species don't exist, we can actually have lower nitric oxide production coming from our mouths. The nitric oxide score measures the capacity of a patient's oral microbiome to convert nitrate from their diets into nitric oxide. So it's taking a look at the bacteria present as well as the genes of those species that are needed for that conversion activity. So a low score here for the nitric oxide might mean that the patient needs more nitrate-rich foods like leafy greens or beets, or lifestyle changes. And this insight can actually be a great complement to myofunctional therapy or sleep-focused care, where you're already addressing these issues like mouth breathing and nitric oxide production. The fourth and final differentiator is guidance on care and ongoing support. So we have resources that provide both in-office and at-home care guidance based on Bristle test results, including hygiene routines, products, supplements, and even diet and lifestyle suggestions, as well as in-office treatments and adjunct therapies that you might want to consider. Here's an example of our in-office care guide, which shows different therapies that you can consider based on the Bristle test results. And similarly here for home care, diet, and lifestyle, we have guidance that includes information for different routines and supplements, brands, as well as recommended use and frequency. Importantly though, you are in complete control of the patient's treatment plan as the clinician. So for each patient report, you'll receive an initial set of home care guidance from Bristle based on the test results, but everything within the treatment plan is customizable. So you can adjust the products, frequencies, routines, whatever fits your approach. And you can also create templates for protocols like high caries patients or gingivitis cases. So with just a couple clicks, when you get a patient's results, you can easily apply those treatment plans for your practice. We know that implementing any new technology can feel overwhelming and requires time and effort. That's why our team is here to support you every step of the way. So we offer onboarding, team training, and even after once you get started, we offer free one-on-one clinical review calls to go over any patient results, treatment planning, and any questions that come up. We want you to use us as often as you need, especially when you're getting started. I hope this gives you a clearer view of the Bristle test, how it compares to other salivary tests, and why these insights can be useful to both you and your patients. We have many more resources and videos that help guide you through onboarding, best practices, and step-by-step processes for actually implementing testing within your existing workflow, and everything else you need to get started. We're incredibly excited to partner with you and support you as you integrate testing into your patient care.